Welcome to the Healthcare and EdTech in a Health Crisis, Accelerating Advancements and Ensuring Access, presented by Edelman. Now a word from our sponsor.
Hi everyone, I'm Lee Allman.
Welcome.
Hi everyone, I'm Lee Allman, and I lead Edelman's reputation and advisory practice here in Southern California, which we've been proud to serve since 1965. On behalf of the 120 marketing and communications consultants in our office, I want to thank the Chamber for convening this important event, inviting us to sponsor it, and to all of you for attending. You don't have to look far to find evidence of technology inequities in education and healthcare, nationally as well as right here in our own state and city. Just last week, a new study found that more than 100,000 low-income college students in California lack access to the kind of technology they need to participate in online classes. Younger students aren't any better off, with far too many stories of families having to park in front of libraries and fast food restaurants just so their children can log onto the internet for school. And that's just in education. A report this summer from McKinsey suggested we could be about to witness a sea change in how healthcare is provided. According to that report, virtual visits could account for up to $250 billion of what insurance currently pays for in doctor visits, up from just $3 billion earlier this year, with huge cost savings resulting from fewer ER and hospital visits. But in a world with such a massive digital divide, how can we ensure that underserved communities will have equal access? These are long-standing problems, but they've been both further revealed and exacerbated by the pandemic, and we have no choice as a community but to solve them. Edelman is deeply committed to helping companies, governments, and NGOs develop solutions to major societal issues just like these, and to helping ensure that stakeholders are fully engaged and informed along the way. So with that, I'd like to hand it over to the moderator for a great conversation. Thanks for joining us today.
Please join me in welcoming our moderator for this session, Mike Zozaya, serving as Account Director at Microsoft. He's a proud member of the Microsoft Public Sector team where he pursues his passion of serving government clients. Welcome, Mike Zozaya.
Want to thank you all for being with us, and want to especially thank Mr. Ray Lowe and Dr. Francisco Rodriguez for joining us as well. We'll go ahead and do brief introductions, and then we'll be digging into some great questions that we know we'll get some great answers to. So I'll start with you, Mr. Lowe. Would you mind giving a brief introduction of who you are?
On behalf of Altamed Health Services, thank you for including us in this critical conversation. I'm the Senior Vice President and Chief Information Officer for here at Altamed. Altamed, we are a community provider. We primarily serve the Latino, multi-ethnic, and underserved communities in Los Angeles and Orange County. We treat over 300,000 patients, over 1 million visits. Many of those have the ability to pay or not ability to pay. We're a leading provider in the Medicaid space and also in the Medicare space as well. And we are really committed at our core about social equity and limiting health disparities and delivering quality care without exception.
Hi, good morning. I'm Francisco Rodriguez. I serve as the Chancellor of the Los Angeles Community College District. And let me welcome you and everyone tuning in to this very important conversation on behalf of our Board of Trustees, our faculty, staff, and our over 200,000 students who enroll at one of our 9 colleges throughout Los Angeles County. So wonderful to be here, and I look forward to a good conversation.
Great. All right. Well, thank you both for those introductions. We'll go ahead and get into our questions, which are going to be centered around health and education. Obviously with the panelists we have here, leaders in both of those industries. Mr. Lowe, I'll start with you. Quick question here: as healthcare, healthcare and education are 2 essential industries that were immediately and severely impacted by this pandemic. What were some of the immediate shocks to the system in healthcare, and what was the role in technology to help solve some of those challenges?
Yeah, so, if we think back in February, we're all watching the news and we're hearing stories about the coronavirus coming out of Wuhan, China. We're hearing about, cruise ships and passengers being isolated for this disease around there. You go into March and the CDC and our elected officials are telling us to stay home, to social distance, to shelter in place. This really impacted healthcare across the country. It meant that patients, whether they had a critical issue or whether they were just taking care of routine care, were now putting off care because they were in fear of their lives. And a call for a healthcare company is, how do you educate not only our patients, but also our clinicians and our staff, so that they feel that they're safe in providing that care and looking at new ways to do it. So, that being said, at Altamed, we rallied around our medical director of infection control under our governance leadership, and we put together a multi-pronged plan very quickly, in a matter of days and weeks, in fact, on how we'd address the pandemic. But from a technical perspective, we looked at how do we go ahead and provide, keep our staff safe? How do we communicate? So we had to create instant WebEx meetings out there. We pushed over 1,500 employees to work remotely. We also had to open up many drive-through clinics in parking lots or in empty spaces that had no type of services available to them. And then we also had to modify our electronic medical record system. COVID-19 was new, right? So the protocols around COVID-19 and how you would administer it, test for it, validate, and communicate back to the patients, it had to be decided as well. And then, we also had to ensure that we were cyber vigilant. So again, we need to protect health information for our patients, right? Ensure that they are properly protected. Just some numbers for you: 700 laptops were distributed in a month. 1,500 people moved to a virtual work environment. We use a Cisco WebEx platform. Our CEO called a all-hands meeting for leadership, 400 people on the next week. We had great help from AT&T, increasing our bandwidth so that we can meet these demands. And even more importantly, we looked at how our patient service center was working. And that's our front line. So as the citizens of Los Angeles were looking, how do I get COVID-19 testing, we were listed on the county website. And people were calling in to say, can I get an appointment? Can I get scheduled? Which we did accommodate. But also the other aspect of it, that's also where they came, or to find out what the result was. I mean, think March and April, if you're testing COVID positive or not COVID positive, it was a very, very stressful time. And I think one other example that we did as well, in terms of partnering with the city of Los Angeles, is we actually opened up a mobile drive-through clinic in Boyle Heights behind Mariachi Plaza that had no power. It had no internet services on them. And at one point, we treated north of 250 patients a day, doing drive-in COVID testing for 7 days a week. And we were able to deliver that to meet the needs of the city. And then lastly, in the April time period, we moved to our video visit platform. So not only were we looking at how do we provide telephonic care, but how do we provide televideo care, and how does that, become part of the norm?
Wow, incredible response to this pandemic. You hit on a few different things that I just caught my ear. One, just enhancing and enabling your organization to leverage the productivity tools you own to be able to respond quickly, you said within weeks, which is impressive. And then to take on an EMR adjustment in the middle of all that, that is quite a task. And then, like you said, while fending off cyber threats, all in an effort to serve your patients. So applaud you for your response there, and thank you for that answer. Dr. Rodriguez, I have a question for you here. What were the immediate shocks of the pandemic to the community college system, and how did technology help you to address those challenges?
Yes, thank you, Mike, and I appreciate hearing Ray's answer as well. Excellent responsiveness on behalf of our Altamed partners. We had multiple immediate shocks to our system, and the role of technology clearly was essential in allowing us to sustain our business continuity. First, just a really quick sketch of the community college system. Here in California, we are a collection of 116 community colleges throughout the state, serving about 2.2 million students. Here in LA County, we have 19 community colleges, and of course, LACCD, as I mentioned earlier, is 9 of those community colleges. Overall, the higher education landscape, because I do believe that this question is germane to higher ed in general, we're about 80 public and private colleges and universities in LA County. And that headcount is approximately 700,000 students. We grant everything from associate degrees and workforce certificates, that's the work of the community colleges, to doctoral degrees and professional licensures. the work of our higher education partners. So if you include that 700,000 students with the number of corresponding employees supporting our students in LA County, our higher education ecosystem, if you will, our population accounts to over 1 million people. And that's arguably like the more than any other county in the country. So as you start thinking about responsiveness, adaptability to COVID, doing this, we don't do this in a vacuum. We're all part of the institutions of higher education, and we get the very strict, if you will, orders and protocols that we have to follow. So our impact was immediate focus, like Altamed, on the health and safety of our faculty, staff, and students. We had emergency plans in place for sure, for fire, for earthquakes, and for a pandemic, believe it or not. But the way things were happening so quickly, we had to better understand what was occurring and adapt to it very, very quickly. So organizational resilience, organizational agility really came through. We were guided by state and national guidance and executive orders, clearly, as I mentioned, by our county Department of Public Health and their guidance. But during that pivot period, we had to interpret orders moment to moment. It was a quite hectic, making the best interpretations we could to maintain the safety and health of our faculty, staff, and students. So we immediately, after asking our board to meet an emergency meeting and through an emergency declaration, essentially closed our campus for a week. We transitioned our spring break, which was in April, to butt up against that week, and we had a 2-week period to transition about 10,000 sections of classes and about 10,000 staff to start working remotely from home, and the education of over 200,000 students. Now, we were about 18% online before the pandemic. Now, clearly, we're about 98%. So we moved and transitioned over that 2-week period, guided by our accrediting bodies that support our colleges and accredit our colleges to make sure that we were in compliance. We had a very limited number of campus and face-to-face classroom instruction that conforms with the governor's what's called essential infrastructure. We engaged in massive professional development, Mike, for our faculty, staff, and students to work to be productive in a remote environment. And of course, our leadership team met regularly, every day, every evening, multiple times. When it first started, now we meet several times per week to maintain our communication. Moving forward as one district, our goal has always been to prioritize, and we still prioritize, the health and safety of our students, faculty, and staff. We're all maintaining the integrity of our teaching, learning, and business environments. And of course, sustaining the operational continuity of a very large and complex organization. So we made a lot of rapid decisions to mitigate risk and to sustain our educational mission. Deploying communication was another sort of hit. We've communicated differently, more often, and used technology tools to do that. You can imagine 9 campuses spread out throughout LA County. We had to establish an emergency operations center and then our campus incident command centers, maintain our communication with the state legislature, with the federal government, to advocate for resources, to advocate for regulatory relief around financial, around pass, no pass classes, around emergency withdrawals for students that were having a very difficult time in transitioning, really claiming and wanting maximum flexibility, which we indeed received. So technology was absolutely essential to all of this, to the successful transition. It touches every aspect of our organization, is either facilitated or supported by technology, and allowed us to be responsive, nimble, entrepreneurial, to track, to monitor, to maintain data security and the records maintenance of our faculty and staff to make sure that was secure. So a lot went on, and we will continue to be nimble and responsive as we need, because we're in this for the long haul. We've already called, and I'll conclude with this, we've already called our spring semester to be completely remote or through online learning, with a handful of essential infrastructure classes like nursing, welding, aviation mechanics, pharmacy technology, some very essential infrastructure that keeps the economy of California going, if you will. So we are in this for the long haul, and that's just a little bit of how we got to this position, Mike.
Yeah, thank you for that. And it's just amazing to me, and maybe this is hitting some of the others that may not be as familiar with just the size and scale of the community college district, the number of campuses you mentioned, the number of students, and then the staff, but the staff definitely outnumbered by those students, and to think how you had to really reinvent how you deliver education to these students in a very short period of time. You think about all the little things that it takes to go get books and register, and the things you've done year after year, and has been the norm. You've had to revamp all of that. And
Mhm.
and it's great to hear how you guys were able to do that quickly, and the technology tools that you were able to use to make that happen. And I think it's also important to note that the community college district does much more than just deliver education and to those students, but really is a civic center in some cases to the community. Can you mind just hitting real quickly on a couple of ways that not only the community college district, but maybe some of the local school districts are a center of civic, civic center to help our community?
Oh, sure. Thank you, Mike. Well, in many ways, they are civic centers. They're cultural hubs. Our institutions are directly in the communities that we're proud to serve. So everything from public lectures to theater performances to sporting events. Many of our local people learn to swim at our colleges and whatnot, let alone take classes there. We also have a very robust concurrent or dual enrollment program with all of our local high schools around our community colleges. So it's another way that we give an introduction to affordable, accessible, high quality higher education to our communities. Right during this pandemic, our colleges have served as drive-through COVID testing. Right now at East Los Angeles College, we have our college that is squarely in place as a drive-through testing center with the support of Supervisor Solis. We have distributed food to our students and community members through our colleges in a very safe way, if you will, during this time period as well. So you're quite right. I appreciate you pointing that out. We are cultural hubs, places of gathering, places of connection to our campuses and to our community, and places where people gather to hear and inform and ultimately educate themselves for a better life.
Great, thank you very much. So, Mr. Lowe, next question's for you. Uh, what have been some of the greatest technology advancements you've seen? It's like I said, with the community college districts, people have to reinvent how they deliver their services. You had to do much of the same at Altamed, and at the same time that your technology partners likely had to adjust. I know Microsoft certainly did. We adjusted quite a bit to deliver services to our customers in this time of need and challenge. What advancements did you see, or what stood out to you, and what do you think are some of the short-term and long-term impacts of those advancements?
Sure. So, all healthcare systems, we all strive for the quadruple aim, which is really, it's about quality care, affordability, patient satisfaction, and provider joy of practice. So, as we look at this, many folks that have good healthcare have more patient-centric care. At Altamed, we're looking at how do we create that model for patient-centric care for low-income and underserved communities, specifically the Medicaid and Medi-Cal patient populations. Oftentimes, this lower-income group, they will seek their care out in an emergency room, and their conditions may be much more severe than if we're able to treat them out in the community or in the clinics around there. So in 2019, we initiated a mobile-first strategy, so meaning that we could do things on our cell phone. Many of us may take it for granted that you can and cannot. But when you look at the underserved and low income, it's really been in the divide. It's fallen into an area that we really have to close around there. And so when we talk about like the telehealth, a lot of conversation on telehealth. Some folks are forecasting, 50 to 60% of all visits will now be in a telehealth perspective. Right now, that is really the norm. I think that telehealth is absolutely going to be here to stay. It may be more of a 30% range than the 50 to 60% range as well. But you'll see other things that are being developed as well for home care, for critical conditions. So when we talk about like remote patient monitoring for patients with congestive heart failure, COPD, that allows them to send their blood pressure, their weight, their glucose, their hemoglobin A1Cs to a remote clinical team that's actually monitoring them from their home and are actually able to do intervention from them at the home versus have them go to the hospital. It's a real game changer in terms of how we can treat our sick people. When we look at our essential workers and how they can make their selections of spending their dollars, if they have to take the choice of not making a day's wages or going to see the doctor or putting food on the table, it's a real life situation that has to be addressed. The other area is around patient satisfaction. So patients need to be communicated to how they want and when they want to be. And that could be through a phone. It could be through a bidirectional text messaging with a conversation behind it as well. It could be through mailers, et cetera, around there. But it's really important, as we talk to our patients, that we talk to our patients in the way that they want to be spoken to. And what I'm talking about there is cultural sensitivity, linguistic sensitivity. And one thing we do here at Altamed is, we pride ourselves in having, 70 to 80% of our employees come from the community. So if they're participating and they can help us with these, as well as using robust language translation services. And another area we're looking at as well is, provider satisfaction. So as a patient-centered care allows the patients to be and receive care where they want to, how about the provider on the other end? We don't want provider burnout. So the technology that has to enable the video visits, the EHR, the point of care testing, all right, that they have to work and they have to be easy. But at the same time, we have to be respectful of our providers. Many of them will see an 8-hour day and a panel of 15 to 20 patients in a day, perhaps. But then they're going to be going home and they're going to be finishing up their EMR systems. So it's really, how do we ensure that we have joy of practice for our providers around there, and how do we put in the technology in order to support that? In closing, telehealth is here to stay. Remote patient monitoring is going to be here to stay. I think it will continue to grow as well. And then I think, how do we really engage our patients and ensure that they are communicated properly and that they understand, most importantly, understand the clinical messages of their care and how it affects them and their family.
Yeah, those are, two things really stood out to me about what you said: telehealth, and I think that was being experimented with and being more widely adopted pre-pandemic. But what a tool it was during the pandemic and now. I know my family personally used it. It's so talking about patient satisfaction and being able to make sure they're in a comfortable setting, limiting physical interactions, protecting your clinicians and your staff while protecting the patients and not spreading the virus. What a great tool to use. And then, like you said, there's a number of different languages that are spoken in the LA area. So being able to leverage technology as a tool to communicate through those technology services, what a great tool to have during this time. So thank you for sharing those things. Dr. Rodriguez is going to move back over to you and talk a little bit about remote learning and how remote. You talked about it a little bit, that you were leveraging it for the community college district and your community college district, and you were going to go all online here soon. What have been some of the challenges as you had to scale that e-learning presence? I'm sure your systems weren't maybe prepared for that before, and with the massive number of students you have, that might be quite a lift.
It is, Mike, quite a lift, and we've had certainly some challenges, but we've learned a lot along the way in scaling our e-learning and scaling our presence in the online remote learning environment. Just consider that 25 years ago, the system of distance education, as it was called, or distributive education or online learning, was a bit clunky. It was clunky from the standpoint of the platform that sustained the education. It was clunky with respect to the courses that would transition to an online environment, and clunky from the standpoint of the learner. But now, 25 years later, there's been some early adoptions of best and good practices for distance education, for online learning, that has allowed some of these experiences for our students and our student learners to be exceptional. So one of the first things that we had to determine, first of all, was, could our IT infrastructure handle the load? Again, our systems, could the infrastructure handle the pressure of all these folks using online education, using we use mostly a Zoom platform? Could they handle the tremendous amount of technology software pieces that we purchased. Because again, we're trying to provide an equivalent academic experience to our students so that the learning outcomes, the courses that we say translate to the workplace for certificates and degrees, and for those transfer programs that we say to our four-year partners, our colleagues there, that we will maintain the academic quality. So we have to have software simulations in a distant environment, if you will, so that we can meet the learning outcomes of that particular class. So we had to first assess our infrastructure load, if you will, capacity, and we bolstered it and made sure that within that 2-week period, and are still doing improvements now, so that our colleges could perform. We also, another challenge was the digital readiness of our faculty and staff. Not everyone was used to teaching in this environment. Some were used to teaching in an online environment. Others, most not. Again, 80% of our faculty had not taught online or remote faculty. So we had to train, do massive amounts of quality, high quality professional development, and really familiarize those who had not been familiar with our virtual resources. And also the training for students. Many students were not ready for an online environment. In fact, they go to college because they want the face-to-face learning, the engagement in the classroom, the socialization that occurs with student clubs and organization, and the just general college ethos that leads to the education, learning, and training of so many of our students. So the digital readiness piece was a challenge of ours, and we learned quite a bit through professional development, using our professional experts from our faculty and our staff to help transition. We're doing that much, much better. Moving from on-site labs to remote labs, we needed to allow our students to continue to have the same excellent learning experience in a remote environment as they had in a physical lab. So we had to select the right software solutions, the right technical solutions to enable our students to have that quality learning experience. And then the other challenge clearly was the consistency in providing this service. So could we across the board, ensure that there was consistent quality throughout the organization in its service, from those who called, from those who logged on, from those who tapped into our internet services. Could they get the same quality service? So clearly, it started off a little clunky because we were moving very, very quickly, but we've been able to smooth out those edges and ensure excellent teaching and quality services. We've combated this and addressed this, first of all, by estimating that we have about 30,000 students in this digital divide that do not have access to consistent internet access, do not have access to technology tools, those sorts of things. So what we did was engage in a partnership with one of our local businesses, Human IT. They provided several refurbished Chromebooks that we purchased at a very reasonable price and started to distribute them. And to date, Micah, we've distributed over 16,000 Chromebooks and other technology tools, and we've ordered another 15,000 to meet this digital divide need for students. So we're putting actual technology tools in their hands so that they can maintain their academic continuity. We've engaged philanthropy, and our college foundations have done a really nice job in providing extramural support to students to give them direct aid so that they can maintain their academic standing. We piggybacked on procurements through a whole variety statewide of software purchases for our faculty so that they can have the tools that they need to do an excellent job. And I've mentioned already the professional development of our faculty and staff. Now, we don't have a direct partnership with telecommunications companies to assist us with low cost internet access. That would be wonderful, but we've not been able as a system to quite leverage that just yet. So in the meantime, we're taking advantage of the partnerships that exist at the state, county, and LA city level. The LA County has a hotspot finder where it's a website that locates publicly available Wi-Fi spots. So we send those to our students. Now, many of those are free of charge. College Buys is a nonprofit program through our system-wide foundation for community colleges that provides low-cost hardware, software, and internet support and services to our students. So we push that out to each of our students. And of course, the City of Los Angeles and the California Emergency Technology Fund, and every one partner with the FCC to provide low-cost internet services to families who qualify. So that's how we're utilizing the existing resources that within the community, trying to assess what the need is, always trying to assess what problem are we trying to solve, and then attacking it through tools, technology, extramural resources, and partnerships.
Great. Thank you, Dr. Rodriguez. And first, I just want to commend your IT team. Being a 20-year IT veteran myself, to meet the scale of what you said, to scale out the infrastructure to support all these online students, it's quite a task. And so please make sure to pat them on the back and congratulate them for hard work.
I do every day.
Deliver that.
They're
I know
amazing.
it's tough.
Thank you.
So the digital divide and digital readiness. I don't know if you heard in Mayor Garcetti's announcement last week that Microsoft, in partnership with Starry, have partnered together to provide airband services to low-income areas. And when the Microsoft team leading that initiative, briefed me on what they were doing, it kind of hits you, right? Things that maybe some of us take for granted, as so much as internet connectivity, that there are those out there that can't afford that. And just imagine a parent who is struggling, was maybe struggling already, and now the pandemic hits and they're trying to make ends meet, and they got to make a tough decision on, do you pay the bills, do you put food on the table, or do you get internet access so that your child can continue their education? What a difficult spot to be in. So to have organizations, many that you named, and I'm just proud to be a part of Microsoft and Starry, to be able to deliver those services to those low-income areas, that's really gonna, I think, help those individuals. So hopefully we can do more of that now and in the future. When it comes to digital divide, Mr. Lowe, I was thinking when you were talking about telehealth, right? What about those digital readiness? What about those patients of yours that maybe don't have access to internet and those services? How is Altamed maybe helping to address that group of patients?
Yeah, so, as a healthcare provider, we personally can't close the digital divide, but we can be prepared to deliver the care that reflects our understanding that not everyone has access to all the resources. So some things we've done is we made sure that our website is mobile friendly, because patients are more likely to access through the internet, through their phone. So many challenges on different iOS versions out there and different models of phones. So we move towards how can we still provide the information to people that can access it through low bandwidth or through good bandwidth. The other thing is, Altamed is very committed to limiting healthcare disparities throughout Southern California. And, through our care delivery network, we focus on helping families access essential services regardless of their ability to pay. So our civic engagement teams has worked with high schools and other schools where they have offerings of these type of low-income internet packages. But there's a little catch in that, to what you already alluded to, is sometimes they're free and sometimes they're not free. And again, people need to make their choice. The other area that we work from a civic engagement perspective, again, beyond schools and community, is, we offer free flu clinics. We have a mobile van to go out and reach out into other areas. We're active in the HIV community and our PACE programs for elders. Our civic engagement team worked tirelessly in the 2020 census to making sure that our communities were counted. And now, again, on Mi Vota, Mi Salud, my vote, my health, to ensure the community voices, again, are heard and the votes are made and they're not missed. But, the digital divide is real. To your point, there are some good organizations out there that are looking to equip, 5G type wireless in housing projects and other areas around there. I think to the manufacturers of the world, iPhone just announced the iPhone 12. The apps that are being developed actually probably have to be a little more backdated, because folks in low income, yes, they do have cellular devices. Some may be flip phones where it won't work. Others may have an iPhone 4 and iPhone 6 because that's what they got for free. And I think from a community manufacturer perspective, they need to be sensitive about that. And how do we make sure that we don't subconsciously exclude them from that ability to be able to access that care that they need around there? But I think there's more to come. Obama phone in 2017, the other phones that are being developed, the digital divide is being understood. There's more work, but I think together we can work to solve that problem, again, with the colleges, with the schools, but we have to have that voice to advocate for those that are in the divide.
Yeah, absolutely. And thanks for the efforts that you and Altamed are taking to be inclusive of all those groups and to make sure everyone's getting the optimal care that they deserve. Right. Um, Dr. Rodriguez, what are some of the greatest? And I think you hit on a couple of these things. Maybe you could dive a little bit deeper on what are some of the greatest concerns you think about students having to navigate um, the higher education system. You talked about some of the social interaction, maybe lack thereof. I don't know how that impacts the mood and the morale of some of the students. And what resources and support services are you giving, and how students now are doing online learning and all that? You talked about some of the technical things. Maybe you can expand on that a little bit more.
Okay. Thank you, Mike. First, your question earlier provided a tremendous insight about our colleges as cultural hubs and whatnot. And indeed, they are. What we learned through this experience is when we closed physically our campuses, because we're open, I want to make sure everyone understands we are fully open for businesses. We've not curtailed our services. We are fully engaged now in a remote learning and online environment for sure. But what we learned was that our colleges are also places where the students engaged for their internet connectivity through our libraries, through our cafeterias and other places. In other words, this was their primary place where they did their homework, where they could be students, where they could take time out to bolster themselves. Consider for a moment that LACCD, our local community college, just under 60% of our students are first generation. Over 70% of the students who enroll with us receive some form of financial aid. Over 50% live in poverty. 35% of our students are student parents. Our families that we serve, about 20% come from families that don't have anyone in their family that's gone to college, let alone high school. So we serve a very under-resourced student population, and we're proud to do that. Because we know that education is the key for economic and social mobility. So what keeps me up and my concern is that those students who are dropping out, Mike, may never return, especially our low income students. And the statistics show that lower income students who drop out are less likely to return and to complete. That worries me a lot. When our low income students drop out of school, it diminishes their job prospects, their social and economic mobility. It fuels the lack of education, a bifurcated system of opportunity and of results. That's why the business community in this discussion is so vital. The anticipated threats to our California higher education landscape and our tenets of access, equity, and affordability are real, as Ray pointed out. You can see enrollments are down nationwide, and in California, enrollments are down with our students, and that's not good. So this public health environment, if you will, this public health emergency has exacerbated the inequities and shined a bright light on both health, education, and economic disparities that exist, especially for the most vulnerable student populations who were already under-resourced before the pandemic. We've talked about some of this, but student basic needs such as food, housing, employment, mental health, access to technology and technology tools, emergency aid have become much more prevalent and disproportionately impact underserved populations and communities. So when the enrollment figures first came out, all across the nation and in California, community colleges have experienced the biggest decline. And students of color in particular from low-income households already hit and suffering, if you will, before the pandemic, have been the hardest hit, both in health, finances, and in education due to the pandemic. So we provided some support with advocacy through the federal aid, through the Federal CARES Act and the state budget, which provides direct aid to students. Our district has recently signed a couple of MOUs with LA Room and Board and Shower Hope, some excellent nonprofit organizations to support students who are homeless and were homeless before the pandemic, but now more exacerbated. We've had some wonderful success and support through our district foundations with Kroger, Ralph's, Food for Less, to distribute the food cards to our students who need $50 for food. To your point earlier about making choices about internet or food or other kinds of life necessities. And of course, we've used our colleges for food bank distribution. So in the same way that our colleges and universities are essential partners to our nation's defense against this community spread. We're going to be essential in transitioning, if you will, the economic vitality and responsiveness of our community, our state, and indeed our nation. So community colleges and higher education will be essential to the nation's economic recovery, and we're going to leverage every resource, including robust and coordinated advocacy efforts to ensure that higher education's role as regional, national economic drivers is understood, and that our voice and influence are present to continue the investment in higher ed when indeed it is needed the most. So to our partners in education who can assist us, our regional higher education institutions require continued investment to support workers to reenter the workforce after job loss, businesses to minimize further job loss, create new jobs, and prepare workers and students for today's in-demand jobs and those leading to economic growth after the pandemic. So the partnership that we require with our businesses is, Mike, essential, necessary, timely, and wanted.
Yeah, thanks. And you said it just right. This pandemic has highlighted the inequalities that must be addressed. Very much so. So, we all need to be involved in improving things there. I'm going to double click on something you said about preparing. It sounds like preparing folks for their workforce, right? And with this pandemic, there's the job market has changed a bit. And maybe now, and maybe probably going into the future, right? Permanently. I know Microsoft. You've probably read in the news that we've made significant investments in global skills initiatives to provide advanced technology training to all different levels and many groups, adults and youth alike. What is the community college district doing maybe to revamp its curriculum for students and maybe even non-students to help with this workforce development skills initiatives?
Yes, thank you, Mike. Well, first, most of our courses are either 16 weeks or 8 weeks, and that's just too long to pivot for some services and some of the education and training that's needed in our community. So we've developed a series of short-term certificates, particularly in the areas where the workforce is needed the most. So short-term technical training, and this could be done at no cost or very low cost. No cost through our adult education programs. We have some for everything from language literacy, numeracy, to computer and technical skills, to the more formal programs, if you will, on the credit side of the house that allows for students to get some training in education in 6, 12, 18, or even 30 units, if you will, for a full certificate or a certificate of competency. So short-term training has been our key. Secondly, we moved everything to a remote platform. You could take your classes on this now, if you will, so that it is much more accessible, assuming they have access to the internet. Again, that is a challenge for many of our folks. It is super important that they understand that it is online, much more convenient, and we're teaching classes both synchronous, that is real time, as well as asynchronous, where a student can go back anytime during the week and complete the courses and if you will, courses, materials, assignments for that particular week, and have access to the instructor in a different way. So both synchronous and asynchronous delivery is also part of what we are doing. And then we're also very engaged in identifying low-cost textbooks, low-cost materials. We've adopted the online educational resources platform where our faculty and our students can have access to high-quality materials for education at zero cost. It's a free platform for curriculum materials, etc. And we've adopted that, and many of our faculty are utilizing that to, again, mitigate the cost, maximize access to higher education, and just ride through what is a very difficult period for families who are underserved, under-resourced, and low income, to stay in the game, maintain academic momentum towards your goal. So that's it's all hands on deck for us, Mike. I'm sure as it is for Ray and his team. It's we're doing human touch in a digital environment, and that can be done, and we're doing it.
Yeah, I
Great.
think it's so important. Again, I'm sorry, that the human touch, right, in this new digital environment, and and the fear, when you talk about quality and quality of life, yeah, and patients, right, putting off going to see their doctor to control their diabetes or their hypertension, the downstream effect of delaying the care, it can be catastrophic, and here at Altamed, we've really looked at what is our clinic new normal, how do we provide safe environments for not only our staff, but for our patients to come in. I mean, we're putting in technologies that we actually know when the patient is en route to us, and that we'll be able to let them wait in their car and to come to the clinic when they're comfortable coming to the clinic, versus the more traditional method, or offering a televideo visit or a telephonic visit if they don't have the internet and bandwidth, because we don't want people to go without care. Right, we don't want people to get sicker, and for many folks, it's a decision, and it's a decision that they're making out of fear. But we need to make sure we treat them and keep them healthy and keep the community healthy, right? So they can be vibrant and continue to have wonderful and healthy lives.
Right. It's an ecosystem, and by doing that, you're saving the health of others. And I forgot to mention, I'm actually pulling these questions from the audience. Some of these are coming in from the audience. So very, very active audience here sending us questions. And I wanted to highlight something you said, Dr. Rodriguez, about the certificates. Those are near and dear to me, because I actually started in IT not by getting a degree, but by getting a certificate. Mm-hmm. So for those that might think a certificate's not as good as a degree and it won't get you as far, well, I would say, especially in IT, that's not the case. There's a lot of folks that I know that never got a degree. Not that I'm saying it's always better to get a degree, in my opinion, but the certificates are definitely worth it, working to achieve, because they can get you that tech job for sure, and amongst others. So then Mr. Lowe, you started to address another question that came in, which is, what is the new normal going to be for healthcare, and do you see Altamed going back to the way things were quite a bit, or how are things going to look maybe post-pandemic for Altamed?
Yeah, I'm sorry, I answered it a little bit earlier. The world has changed and the new normal is here. I think some of it's still being defined. Again, I think it's all about patient-centric care. And before, I think folks had a choice. There was much more focus there. And now, through the pandemic and companies like Altamed, we're looking at how do we extend that same quality of care, that same human touch, to the underserved, so that they feel that they're being taken care of. Obesity, hypertension, they are rampant in the communities that we serve. So what are the programs that we're putting into place? How are we communicating to them? Through bi-directional texting, through messaging, sending reminders. Another part of healthcare is all quality, your quality metrics. How are we managing these diseases? How are we managing women's services? How are we managing, child well visits around there? So, we are moving very actively to have more patient engagement. Again, communicate to the patient, offer them different ways of receiving their health care, versus having to come into the clinic, recognizing, what's happening, and people are scared. So, I think, again, the mobile is here to stay, and it's going to continue. The telehealth is going to continue to stay. I think there's some adoption issues in that space. Even from I'm an IT guy, clearly, right? I can understand how to use it. But when you put the question and do the video visit with somebody who doesn't even understand what you're really asking them to do, and click here and click here and click here, can you hear me? Can you hear me? I think there's some hurdles that we have to work through in the community to make that more of a normal. And then I think that part from a care perspective, if that's not effective, well, we still need to provide the care. So we should do a telephone visit with them, et cetera. And I think the other area, is there's a lot of opportunity in behavioral health. There's a lot of sadness, through the pandemic, and folks are really hurting out there. And we have to be sensitive in terms of how we help folks, again, through this, so that they are not only well physically, but mentally, and going through the process. So the world has changed. It is patient-centric. It is a digital future, but we need to make sure that the divide does not truly become a divide and prevent folks, everybody, right, from receiving the right care.
Got it. Definitely agree. And while the pandemic's been painful, some of the things you both have said, I think, have changed some things for the better, right? In some ways, right? In uncovering new tools and new processes and ways to engage and provide better care, like you said. And one of the members of the audience sent on the topic of behavioral health, Dr. Rodriguez, one of the members of the audience, wanted to hear a little bit more about what the community college district is doing to help those, that maybe are struggling a bit with mental health.
Yes, thank you. It's a great question. I appreciate the audience member pointing that out. Through our surveys, and we've done multiple surveys from faculty, staff, and students, but in particular students, they have indicated that 3 out of 4 are experiencing higher levels of stress and anxiety more than usual as being a college student. So what we have done is several things. One is this last academic year, our students voted to increase their health fee, if you will. And that's pretty unusual for students to want to tax themselves for a health fee, but they did throughout the district, which would allow us to provide additional support around mental health. So this was already in motion, additional hours, and right now it's all telehealth, telemedicine, if you will, for our students. So they have access to free telehealth through the providers at our different colleges, and of course we refer them to county services as well. And I meet with students all the time, sometimes weekly, to get a sense, and this continuously comes up, the issue of how they're balancing the multiple demands of being a student, a parent, the academic expectations, the parental expectations, if you will. Some of them have had job loss in their families. Others are living in intergenerational households. Some have children that are now also learning at home, if you will. So they're managing, struggling in some cases with how to be teachers to their children. At the same time, they're trying to be students themselves. Some live in multilingual households and whatnot. So there's a lot of bit of stress. So we have revamped, if you will, the number of available slots, if you will, for students to literally dial in or to log on to private mental health counseling that will allow them to get through. Our district has a very strong employee relations program that provides support to our faculty and staff who are having a difficult time adjusting to this environment. It's not unusual to be stressed by this, to be impacted by the rapid pace of change in this particular environment. Some are simply concerned about their physical health and don't want to go outside at all because of the unknown nature of how the spread and the devastation that it has had. As you know, Los Angeles County is the hotspot for California. So we've had to deal with that as well, maintaining a level of support, empathy, confidence, trust, and providing them the tools so they can work effectively, or giving them the time off that they might need to remain productive, because the public demands that we continue to deliver on our mission. And that is our zeal, that is our passion, and that is what we have been committed to do. The resilience of our organization has been remarkable. The innovation involved. You're quite right, Mike. We've learned some things. We're much more agile, much more mobile, much more responsive than we thought we could ever be. And we've had to do it because of the health and safety of our institution and the business continuity of our organization. We know that education is the tool to move forward out of poverty, and the tool to move forward in terms of mobility, if you will. And what's important is as we recover and start to come out, and as that we have an inclusive recovery, an inclusive economy that includes all, or else we're going to be contributing to a bifurcated system that we already have in our society with respect to wealth and opportunity. While there might be wealth gaps, we want to make sure that there are zero opportunity gaps, that every person who wants and desires a higher education at an affordable price that's high quality can come to somewhere at the community colleges. And as you know, through legislation that's been passed by Assembly Member Miguel Santiago are sponsored by our district and authored by him and signed by Governor Newsom. We now have 2 years of tuition-free education for all Californians, irrespective of zip code, station in life. If you enroll first time, full time, 2 years of tuition-free education in whatever program you desire. So that is the California promise, and we have to make sure that it is inclusive and involves everyone in our recovery.
Yeah, terrific. And glad that, just to highlight then too, that you're providing access to services, as needed by those that are struggling. I'm gonna go. We have time for one last question. I think both of you could likely give answers. I'll ask you, Mr. Lowe, to answer first, and then leave some time for Dr. Rodriguez to give his answer to this question. The question comes from Andrea, and really is centered around small medium business and how important it is to the city and to the county and our community. I know Microsoft's taken this very, very personally and have invested in making sure that small, medium business organizations have access to enterprise tools. Sometimes it can be a bit pricey to have those enterprise tools when you're a small, medium business. We specifically focus on Black and African American owned businesses, and so we're really proud of that. But what Andrea says here is that 90% of the businesses in Los Angeles actually have 20 employees or less, and it can be hard to compete for business from organizations the size as the community college or Altamed with some of these maybe national firms you could work with or not. But how do you see Altamed? Start with you, Mr. Lowe. Maybe making it a fair playing field for these smaller businesses to compete for business.
Yeah, I really believe in small business, that it's the lifeblood of the communities, and personally, I think it's very sad what we're seeing happening economically and how it's affecting them, and we need to support those businesses. Again, Altamed, we invest in our communities. We hire from our communities. I think that as we in corporate America need to look at how do we pull folks forward through internships. To your point, Mike, you had a certificate, and in the IT realm, you can start a certificate and you can find your way all the way up to the top by being and really applying yourself, which speaks to the Chancellor, is really about education and eliminating that divide around there. When I look at the big corporations, there was a lot of kindness out of them. A lot of the big companies did step forward, and then they really helped out and had a number of COVID-19 specials, right, where they helped us advance the technology because it was so disruptive, it was so dynamic, and it changed day after day. Coming out into it, 6 or 7 months later, well, surprise, there's a bill on the other end of it, because now we've gone to scale and we've changed things around there. So I think we as a country, we need to kind of reconcile, what is the new normal? How do we want to do it, and how do we want to manage it? Again, on the small businesses, I think we need to invest in them. We need to support them. We need to utilize them. There's no question about them, because they really are the fabric of our communities.
Agreed. Dr. Rodriguez, be able to comment on small, medium business? Although I think maybe his feed froze there. But I think that kind of comes to the end of our time anyway.
Yes, let me add on.
Always coming through. Great.
Okay. Yeah. Well, thank you. Yes. Well, I agree with the person who asked the question. The small business does fuel our economy. At LACCD, we have very specific procurement targets, if you will, for small and medium that fit into the small, emerging, and disabled veterans category. That's what we are able to do through our facilities construction program, our bond, if you will, that was passed in 2016 and the year before through the general residents, about a 35% goal. And we have been hitting over 50% in our ability to contract with small, local, emerging, and disabled veteran businesses in our facilities program. So that's one. And we have boot camps and other ways that we train, educate, and support the competitive application for those businesses that fit into those categories. The other thing I would mention, Mike, is on the ballot is Proposition 16. And I believe that the Chamber took a favorable support position on Prop 16 that would remove the 1995-96 Proposition 209 that prohibits the use of race and gender on university admissions, on public hiring, and on public contracting. So that's something else that the folks should look into if they want to give greater access to women, to quote unquote minority businesses that have access to public contracting, then folks should look at that Prop 16 ballot measure.
Yes, thanks for mentioning that. Prop 16 would be very impactful in helping those small medium businesses, like I said, minorities and women. So thanks for that. Well, real pleasure having this chat with you two today, and really appreciate you carving out the time. Terrific answers, and really thank you for all that you're doing in your organizations and the broader community. Thank you very much.
Thank you.
Thank you, Mike. Thank you, Ray. Take care.
Thank you. It's a pleasure.
Take care, everyone.
Thank you for joining us for the Healthcare and EdTech in a Health Crisis, Accelerating Advancements and Ensuring Access panel presented by Edelman. Up next, we have the Reimagining Tourism and Hospitality and the New Economy in LA's Entertainment Industry sessions available. Please select your session of choice under the Sessions tab at the top of your screen. We will see you back at 11:10 a.m.